Hello everyone, good afternoon. Today we will be continuing our chapter male genital urinary system, and we will start with a small disease condition which is termed as balanitis. So balanitis is nothing but inflammation of the glans penis. So as we already know, the glans penis is also called as head of the penis. So the definition is the inflammation of the head of the penis which can be caused by either bacteria or fungus or uh, even virus. Sometimes it will come along with other infections like posthitis. Posthitis means inflammation of foreskin. So together it can be called as balanoposthitis. So based on the different types, um, it is categorized into different types based on causes. The first one is infectious balanitis, which is caused by bacteria, fungus, or virus. Common fungus is Candida albicans. Second type is irritant balanitis or non-infectious balanitis, which is occurring due to poor hygiene or over hygiene, both extremes, or usage of harsh soaps or detergents, or contact with urine or fecal material. Third one is allergic balanitis. You can identify that due to any of the allergic particles. It can be due to latex or any perfumed soaps or condom lubricants. Fourth one is Soon's balanitis, and it is also termed as plasma cell balanitis. That means due to the plasma cell infiltration into the glans penis, this kind of inflammation can occur. It is a chronic non-infectious inflammation and commonly seen in uncircumcised men. Fifth one is lichen sclerosis, or other name is Balanitis serotica obliterans. It is considered as an autoimmune disorder, and it is also a chronic inflammatory disease. Sixth one is reactive balanitis. That is also an autoimmune response, which is occurring after a gastrointestinal or genitourinary infection. Reactive balanitis. And seventh one is diabetic balanitis due to uncontrolled diabetes. This commonly occur due to the Candida overgrowth. And final one is traumatic balanitis due to any aggressive activity or friction, commonly occurring during the sexual activity or during the masturbation. So these are the different types of balanitis: infectious balanitis, irritant balanitis, allergic, Soon's balanitis or plasma cell balanitis, lichen sclerosis or Balanitis serotica obliterans, reactive balanitis, diabetic balanitis, or traumatic balanitis. So commonly we studied the different types of etiology. Again, generally we have to study this. The etiological factors are poor hygiene, commonly seen in uncircumcised men, sexually transmitted infections, use of soap, over usage of soap, shower gels or condoms, fungus like Candida, bacteria like Borrelia vincenti and Streptococci, viruses like human papillomavirus, or due to any of the allergic situations, diabetes and obesity, and infections which got from the sexual partner. So these are the etiological factors generally. Pathophysiology is very easy due to the etiology like unhygienic practices or over hygienic practices. In case of unhygienic practices, the foreskin is not routinely retracted and the glands is not cleansed properly. So there will be buildup of this bacteria, whatever organisms inside there, including the sweat, debris, and exfoliated skin. It will lead to inflammatory changes, and there will be development of infection, and it will lead to balanitis. Clinical features, of course, there will be uncomfort feeling over the penis, redness around the glands, inflammation, soreness, itching or irritation, rashes over the glans penis, a thick lumpy discharge under the foreskin, which is very small, foul smelling, painful urination, or sometimes difficulty in urination. Lymph nodes will be enlarged near to the groin. If inflammation occurs, there may be chance of fever, so as well as chills. So these are the clinical features we can see associated with balanitis. How can we diagnose the case? There is no much test to find out this. By proper physical examination, we can identify. Skin biopsy is very rarely done. Blood test can be done in order to find out the high level of leukocytes or white blood cells based on the fever. How can we manage this? So managing is, if the cause is bacteria, we will start with antibiotics like amoxicillin, penicillin, and erythromycin. If the causes is other organisms, we will start with the steroid creams, 1% of hydrocortisone. If it is fungus causes, we will start with clotrimazole. And in severe cases, if circumcision is not done, we will do that. Circumcision can only be done after the treatment of inflammation. So inflammation should go away, then only the surgery can be done. Potassium permanganate solution can be used, very mild amount of potassium permanganate to clean the foreskin. Swiss bath sometimes helpful to relieve the discomfort. And in case if the patient is diabetic, glucose level should be controlled. So nursing management, as we know, we have to assess the clinical features and we have to check that how it affects the patient's daily life. We have to seek about the sexual history, because if some persons, if there is any sexually transmitted infection, we have to tell them to abstain from the sexual activity with the partner. Check vitals, teach the patient about application of prescribed skin ointment. The ointment will be available for steroid, hydrocortisone, so that should be applied properly. Teach the patient to maintain perineal hygiene. So you can add some more points regarding the perineal hygiene, and advise to avoid use of strong soap as well as detergents. Continuously we have to provide psychological support. So these are the nursing management. And some complications like a scar and narrow opening of the penis is been seen. It will affect the blood supply of the penis also. So these are the rare complications. So that is about balanitis. If any doubt, you can ask me separately or through WhatsApp. Thank you.